Hello there, once again, this is Dr. Jack Bielitz, and welcome to another episode of the Ask Dr. Jack Show. We are here not trying to give you medical advice, especially on this episode. We're just trying to give you great information that you could very easily pull up on the internet yourself, but we're going to make it accessible so that you have information that you can use to make intelligent and informed decisions for not only your health, but in this particular case, for the health of your kids. So, with that, our topic.
Well, last week we talked about diagnosing ADHD, and so this week we're talking about the treatment options people have after their child is diagnosed with ADHD. The specific one that we're really going to talk about is the medications that they put these children on. So,
okay, so the reason this topic came up because there was a great study that was just done, and it was about what happens to kids who are misdiagnosed and get put on these medications. And, you know, we said last week, and if you want to go over last week's, I think it was episode 141? 143. So go look at episode 143. But it just shows you how insane the quote-unquote diagnosis of ADHD is. I mean, it's just so subjective, it's ridiculous. And so it's very easy for a kid to be misdiagnosed. Now, the person that really fits into the norm of a ADHD kid is one that has a problem with a neurotransmitter. Was it dopamine?
Dopamine.
Yeah, dopamine. So basically there's a part of the brain that kind of is control central. It determines what goes where, and it's kind of the gatekeeper, and it sends signals to what different places and things like that. And if there isn't enough dopamine, that center cannot function properly. And so basically when you put a kid on Ritalin, which, hey, let's face it, if you get the diagnosis, what are you going to do? You're going to put the kid on medication. And so it increases those levels. Well, what happens if you have okay levels of dopamine in your brain and you put these kids on medication? All right, that is a huge thing. Now you might be thinking, okay, well, how easy is that? Just get the levels of dopamine and, you know, just, yeah.
Well, but dopamine doesn't just help with concentration. I mean, dopamine is a transmitter and a chemical that's used for different things in our body as well.
Yes.
So when you
but not only that, but everybody's got their own normal level.
Exactly. So when you start messing with, we're going to make more, we're going to take some away, or we're going to change how your body's releasing it, then you're changing.
Yeah. So, you know, if there is no test that will tell you this particular kid has enough, this particular kid doesn't, you know, it has nothing to do with that. I mean, that's the problem with this crappy diagnosis. So then what happens is you get over the amount of dopamine, and it so overstimulates the brain that the kid literally shuts down. So you've probably seen this with some kids that are on Ritalin. They're just like zombies, you know, they don't do anything. And, you know, it's crazy, you know, what these poor kids are having to go through with their brains.
Well, it's sad, and the scary part is that we really have no idea how this affects them in long term. Like, there's studies that show that children that are diagnosed with ADHD grow into adults with addiction type problems, and then there's also studies that show that, you know, these kids can never function without it because their brain potentially stops producing the dopamine or stops releasing it properly. So, you know, that changes how they feel joy, that changes how they feel about reaching goals and doing better in school.
Which is going to affect, you know, how good your marriage is, or even if you bother getting married, if you do well in your job, or even if you bother even wanting to get a job, because, you know, if I don't have the motivation to do it, why am I going to bother putting myself out there? Or, you know, there's just none of that. Plus, like you said, the addictions to things like cocaine are huge. So, big problems with these medications. And those are the problems that come up, or, you know, like the addiction and the lack of desire to do things. Those are on quote unquote properly diagnosed. So these kids that are turned into zombies are even worse off. Right. That, you know, it's crazy. So, you know, a lot of people are saying, okay, what can we do about it? What should we do about it? I mean, my kid's got a problem. He's not functioning in school. You know, you have to look not at the symptom of not being able to concentrate. All right, that's just a symptom. What is the cause of that problem? That's what you have to look for. And what we're finding out is food allergies are huge. Medical doctors aren't set up to really be of any help in diagnosing that. You know, they are there to give out drugs because that's what they're good at.
Well, they're there specifically to treat a symptom. You have a runny nose, they give you a pill for a runny nose. You have a problem concentrating, they give you a pill to make you concentrate. Instead of figuring out why we have this problem concentrating or why we have the runny nose, they just make it stop. And that doesn't solve anything. It's like putting a Band-Aid on a broken bone.
Excellent way to put that. You know, it's crazy. So, a suggestion. If you have an issue or a potential issue with your child, or maybe your grandchild, or maybe your friend has a problem, consider getting them to a chiropractor first. We can diagnose things a little bit easier. We're going to have a different way of looking at it. And if that doesn't work, you haven't messed with anybody's brain chemistry. You know, and studies are showing huge improvements in kids with these problems by just taking some of these big things off the table, like, you know, allergies and things like that. So please consider that. That is huge for our kids. I mean, they're the ones that are going to be taking care of us, supporting us in the future. I mean, we need this next generation. And, you know, it's, what are you going to do if they're not doing what they need to do because they're medicated improperly? So, and a lot of this, you know, goes back to even teachers. I mean,
God, I hate that word normal. I really do. It's just, it's what is normal for me is not normal for you. And what's normal for your child is not normal for another one of your children. And you know, talk to your kids as teachers and, you know, make them make a plan as to how to handle these problems without medication. Because it's possible. I know plenty of people that have done it. I know you do. You can deal with these problems without medication.
So, if this pertains to you or a family member or a friend, please share this video with them. Like our YouTube channel because that will help us get the message out to people. Go to our Facebook page, like our Facebook page, because again, that's another way we disseminate this information. I mean, this is our children's future, and this information is so important. And when people are faced with a problem with their child, they're just looking for anything that can help. And if the only thing they know is the medical doctor, that's where they're going to go. So we have to let this information get out to people, and it's only through you and your little click on the like and the share and all the other things that go along with this that will help get this information out to more and more people so that they can maybe get a little different idea of how they can work with their child. So that's it for this episode of the Dr. Jack Show. And we can't wait to see you on the next episode. So have a very happy and healthy day.
Bye.